to be a premier referral hospital renowned for clinical excellence, in clinical care, training, research, and innovation. Where the mission for the hospital is to enhance the health and well-being of Kenyans and global citizens through provision of patient-centered and evidence-based healthcare. The reason why we are here on the stage as a hospital is because our flagship project is on oncology. We are actually positioning ourselves to be the leading referral hospital in oncology. And so that's why we're here. We are supporting, we have partnership with some counties. We have signed MOUs with some governors in order to enhance and capacity build their cancer centers and all that. So I'll be very short. You can go to the next slide. Next slide, please. Okay, so our services range preventive care and screening, diagnosis and treatment. Okay, good. Yes, so I've talked about our flagship project, which is oncology. Our services range covers preventive and screening, diagnosis, treatment, and these are some of the services that we provide. We have a booth there, so I want to go and talk about all these services that we have. I think many Kenyans remember KUTRH for being the major COVID center. When we operationalized, when we were supposed to commission, then COVID hit. And we have treated majority of COVID patients in the country. As a result, we have the largest ICU capacity in the country. We have 68 ICU beds, and we'll be having additional beds in the future. We also have, that screen shows you, we have a wellness center where we are doing the efforts to do the screening before, I'm sure you know the challenge with many Kenyans was that they are coming to hospitals during the later stage of their disease. Now we're doing a lot of screening so that we're able to detect the disease very early. So we have a wellness center. These are some of the services that we also provide. Okay, I'm not sure if you can see that screen very well, but you can see from 2019, late 2019, when we had first accepted our patient. The first patient was in October 2019, and then later COVID hit. So you can see we have only seen 896 patients. But last year we had seen, for outpatient, we had seen 67,917. And then you can also see a steady growth in the number of patients for inpatient services. Okay, just really briefly, we are offering these services. We have opened the KUTRH Training Center for Specialized Nursing. These are some of the courses we provide: Kenya Registered Oncology Nursing, Critical Care Nursing, Nephrology, Preoperative Nursing. And then for our medical officers who are working with us, we have also launched these programs for them so that they can be able to get their masters. We have the COSESCA program, which is fellowship in surgery, and then we also have the ESCASCOP, which is a fellowship in internal medicine, and then we are going to be rolling out the CANESCA program, which is training in fellowship in anesthesiology in the next month. Okay, so we are also the only referral hospital that is doing research, because our name KUTRH, the second R is research. And as new as we are engaged in some collaborative research. We have partnership with the University of Manchester in the UK, as well as the Christie Hospital Foundation. We have done a proposal. In fact, we have a grant worth almost 500 million, which is ongoing, which is doing some clinical research in COVID. And that research for the Manchester is related to esophageal cancer. Okay, I won't go into details, but we also have launched the Medical Innovation Hub. We have invited Kenyans who are interested in doing research in innovation so that they can come and partner with us. Those are some of the ongoing medical innovations hubs that we have. And we have 3 successful innovations that are upcoming, as you can see on the screen. Okay, so because our theme here for the summit is oncology, we have the Integrated Molecular Imaging Center, which has PET CTs, the cyclotron machine, and we have served this number of patients for oncology, as you can see on the screen. As of January 2023 this year, we had served 58,850 patients.